With over 11,000 cases and 500 deaths so far, the Spanish national government have now declared a state of emergency, called in the military, and nationalized their entire healthcare system. Now, the thrust of their response is essentially they have four main ministries who are now in response to the coronavirus crisis. They have their Ministry of Health, which is now nationalizing their healthcare system, taking everything, putting them under a single control of the government in order to, give unified orders, give unified directions, and make things really, really clear to the public. They have their Interior Ministry, which is maybe a little bit like sort of the FBI is here in America, now in taking entire control of their of all their police forces across the country, even some of the private police forces. They have their Defense Ministry, which is sort of like their military, now sort of in control of things, patrolling the streets, building hospitals, constructing things which might be necessary, using resources from the military in necessary ways, which might be able to aid in public health. They also have their Transportation Ministry, which is now sort of directing public transport, directing various roads, what roads are opened, et cetera, across the country. So really interesting response from Spain. Now, to be fair, they did wait quite a bit. They did wait much longer than they should have than they should have to shut down the entire country. But guys, look, here in America, we are doing the same thing. We're waiting way too long to shut everything down, especially in the United States. What we're seeing is really a patchwork kind of response. Some areas look like they're shutting down. I was just seeing Bill de Blasio has now told New Yorkers to be on alert that there may be a coming shutdown in the next 48 hours. San Francisco is now sending out strongly worded recommendations for everybody to stay home and is limiting some control, some stuff over there. My county in Fairfax County is also declaring a state of emergency and taking control of disaster relief stuff. So basically every single little area is doing a different thing, which is kind of really not how you want to do it. You want to be under some kind of direct national control. Now, in theory, the United States, we could nationalize our healthcare system, but that's pretty unlikely. One of the reasons why Spain is able to do it so much easier than the United States is that the majority of people are already on a public healthcare system. They have a universal plan which covers, like, I think over 90% of the population, vast majority of people. Everyone is universally covered, but there are some people who opt for a private plan. Very few. I think it's only like 3 or 4% of people where you pay for that and you get, sort of faster wait times and you get certain superior coverage. And also because the universal healthcare plan in Spain, I could be wrong about this, but I don't believe that they cover dental and some other things like some other things like that. So, but basically now the national government has now nationalized everything, and all the control is in the national government in response to this coronavirus crisis. Also, by the way, another thing that they're doing is they're now having fourth-year medical students, so people who are nearly done with medical school, who have gone through the requisite training, are now being a part of the coronavirus response directly. So really good moves from Spain on the part of Spain, nationalizing, mobilizing the military. And I do want to talk a little bit about the military piece of this, because we've actually been seeing this debate here in America. I think it was New York Governor Andrew Cuomo saying that yes, he was calling on Donald Trump to use the military in response to this, and Joe Biden in the most recent Democratic debate saying that he did support using the military in response to this. Bernie Sanders hedging a little bit, saying that we should use the National Guard, but said that he was open to using the military. Personally, I actually agree that we should use the military, and I know that that's maybe a little bit controversial. There are some lefties who are maybe a bit skeptical of using the military, and with good reason. I think that whenever we talk about using the military, we should always, sort of hold an extra level of skepticism over that case. But I think that in this instance, it really is a justified use of the military, and that, guys, look, if we're going to spend the money, we might as well use it on public health. And by the way, for the price of one fighter jet, we could have stockpiled 50 million N95 masks, the masks which are now in critical shortage, which we had to get an emergency shipment from China. I think just this morning we got a massive shipment in from China, which of course their supply chains are all messed up right now anyway, because because of the coronavirus. So it's a disaster right now. But I think if we're going to use our military, we should use it for a public health response. And that is how we should use it. And actually our military would actually be really good at doing that anyway, because we have some of the best engineer corps in the entire world when it comes to the military, and it comes to our ability to construct things. We can build hospitals in the middle of war zones, guys. That's how good our engineers are in our military. So I actually do think that we could have do really, really great good when it comes to using the military if we act now. If we wait too long, guys, that's not good. So I really do think that we should act now and mobilize the military for the coronavirus response. Because the reason why Donald Trump is waiting is because he doesn't want to make it a disaster and then the stock market tumbles more. But guys, this is going to be a crisis anyway. We should act ahead of time, act now, act proactively in order to respond to things. And the other thing when it comes to mobilizing the military is that it provides a really good opportunity for just people on the left, for Democrats even just in general, to talk about why it could be a good thing to bring back some of our troops and bring them back home. Because we always talk about how we're going to nation build overseas, how we're going to build nations up overseas. I think we have a really good case to say right now is, hey, look, our country's in trouble. We need to build our nation here at home. So let's, bring back some troops from overseas. Let's save some money that way and focus those resources here for the pandemic. I actually think that we might be able to get some bipartisan support for something like that, if the Democrats actually could grow a spine, Nancy Pelosi could grow a spine and actually be willing to fight the Republicans. I do think that we actually might be able to, get some bipartisan support, be able to actually persuade some Republicans for that case to actually bring back some troops and, use our military here at home. So I think that we have a really great opportunity to actually engage in persuasion, to show the other side, show Republicans how our military and how our resources could be spent here at home as opposed to being spent abroad. So this is just a huge opportunity, a massive, massive opportunity for Democrats, for progressives, for the left, in order to, sort of persuade Republicans in general. So I'm really, really sad that we're not seeing that right now. I do think that's something that we should see. So I'm really happy with the Spanish response overall. I do think, again, when it comes to nationalizing healthcare thing, I think that that's something which is really, really difficult for America to do because we have so many private health insurances. You guys know I support Medicare for all. And we should have a universal plan to make this kind of thing much more easy, make a response to this, much more, something that we could actually do effectively. Instead, right now, Donald Trump has the healthcare industry lobbyists sitting on the boards trying to figure out what they're going to do in response. So we have to end up negotiating with people whose main interest is to make money off this pandemic, right? We have to negotiate with them in order to figure out how this response is going to work. Like, it ends up just being a complete disaster, a complete nightmare, guys. Again, I was talking about in my last video, I think that we really missed a huge opportunity when it comes to nominating Bernie Sanders, because Bernie Sanders could actually make a compelling case for Medicare for all given the circumstances, given the situation, right? Because the criticism always was, well, Bernie Sanders, you're unelectable. But even if you do manage to win, what you're pushing for isn't practical. It's not going to happen. It's never, people don't support it, blah, 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 blah. Now, there's not a ton of evidence for that, but that's what they said. But guys, with this pandemic, there's going to be a ton of political capital to be able to really change our healthcare system substantially, make a real change to our healthcare system. So, having Bernie Sanders would be absolutely perfect, especially right now, right? I mean, at any time for sure, but especially right now. So, we're really missing out on an opportunity to nominate Bernie Sanders. But anyway, so I'm really happy with the Spanish response. So anyway, if you like the video, I'd really appreciate it if you hit the like button and consider subscribing. Thanks.